The Wuhan virus pandemic plagued the world for 3 long years. It altered our lives in more ways than one, and the after effects continue to make their presence felt. Let me tell you about what's happening in Japan as of now. Almost 1.5 million people of working age in the country are living as social recluses. Basically, they have withdrawn from society, avoiding going outside or talking to other people. And for this, a fifth of these people, around 20%, blame the Wuhan virus pandemic and the lifestyle changes that it brought along. That's the impact of the fear of death. Have you heard of the term hikikomori? It's basically used to describe those who withdraw from society, spending all or almost all of their time isolated at home. In fact, the Japanese Ministry of Health, Labor and Welfare defines hikikomori as people who refuse to leave their house and isolate themselves from society in their homes for a period exceeding 6 months. And while hikikomori is mostly a Japanese phenomenon, cases have been found in the US, Spain, Italy, France, even South Korea. In fact, a survey was conducted in Japan in November last year. 30,000 people were surveyed. They were between the ages of 10 and 69. And over a fifth of hikikomori, aged 15 to 39, had been socially isolated for 6 months to less than a year. Over a fifth of those between ages 40 and 64 have shut themselves in their homes for less than 2 to 3 years. Among those in the 40 to 64 age range, 44.5% said that their behavior had been triggered by leaving their jobs. And now, to deal with the issue of social reclusion, a ward in Tokyo, Edogawa, will be holding metaverse socializing events. This will happen from June, so that hikikomori can be given a chance to meet people, rather the virtual avatars of people. Now, we all know that the COVID-19 pandemic and the lockdowns that it brought along brought to the fore the urgent need to safeguard one's mental health. In February 2021, in fact, Japan appointed a minister of loneliness. This was after the country's suicide rate went up for the first time in 11 years. Historically, Japan's above-average suicide rates have been closely linked to the economic situation of the country. And the COVID-19 pandemic, its impact on the Japanese economy, have coincided with this fresh increase in the suicide rates. This was initially driven by rising suicide numbers among women. And technology can also be blamed to a certain extent for what is being witnessed in the country. This results in great isolation. Plus, there is the stigma attached to mental illness. WION now available in your country. Download the app now. Get all the updates on the move.